Federal Health Minister Tanya Plibersek joins me in the Parliament House studios. Minister, good morning.
How are you, Fran?
I'm well, thank you. Minister, before we get to the budget, the Prime Minister became very emotional in the Parliament yesterday as she introduced the funding bill for the disability care policy. What does this say about how important this policy is to the Prime Minister personally?
Oh, look, I think that the Prime Minister, like all of us on the Labor side, have seen this as an incredibly important change for Australia's future. We've met so many disabled Australians and their carers in the course of consulting on this legislation. And those personal stories, of course, stay with you when you walk into the Parliament on such a historic day to make such a historic change. I know the Prime Minister just that day had been meeting with young Australians who have disabilities, telling their stories again to her. And you think about those people when you make a speech as important as the one she made yesterday.
And does the emotion reflect the amount of pressure you're all under? These are pressured times.
No, I think it reflects that we're very happy that this legislation will pass, that the money's in the budget, it's been accounted for the next 10 years. This is as big a change for Australia as the introduction of Medicare almost 40 years ago. It will change lives, and it's a permanent change as well. It's a structural change to the way that we support people with disabilities. It's a really big deal. I think that the emotion's there because all of us enter public life because we want to do something better for people. We want a fairer nation. And there really is few reforms that make such a dramatic difference forever to people with disabilities.
Given the historic nature of it, you've just talked about the impact of this on lives and the nation permanently, were you disappointed that the coalition benches were basically empty? I mean, there was Kevin Andrews there to second the bill, but...
Look, I think it's disappointing. They missed an historic day. This will only happen once. And so
they said they didn't know it was coming on.
Oh, well, I think that's a bit far-fetched. We get blues every morning. They're bits of paper that come around that tell you the program for the day. We've all got televisions in our offices that are permanently trained to the House of Reps chamber or the Senate chamber, depending which side you're sitting on. It's hard to understand how they wouldn't know it was on.
Let's go to the health budget. A number of cutbacks in the health program in the budget, saving about $1.7 billion over 4 years. Can you tell us what the cost will be to patients, one by one, in a sense?
Well, there's a few sensible saves in the health budget and some very strong expenditure. We'll have record high Medicare expenditure. We'll have record high funding to hospitals. We'll have record high funding for primary health care and pharmaceuticals. We're adding almost $1 billion worth of new medicines. And these are huge new investments as well. And to afford those, we've had to trim in some areas. The first one is a pause in doctors' pay. So normally their pay from Medicare, their billing is indexed in November each year. Instead of being indexed in November this year, they'll have to wait till the 1st of July. So that's an 8-month delay. That's a change to the money that doctors receive from Medicare rather than an impact on patient.
But it will impact on patients. I mean, the head of the AMA, Dr. Hambleton, says the sicker you are, the more you'll pay. The government's getting sick people to help fix the budget black hole.
It's just not right because 82% of visits to GPs now are bulk billed. So the patient, when they're bulk billed, sees no difference. The doctors who aren't bulk billing, they don't stick to the Medicare scheduled increases anyway. They charge
not by a
whatever
long
they
shot.
like. So for patients who are bulk billed, they won't see any difference. And 82% of visits to GPs now are bulk bills. More than 77% of all visits to doctors are bulk billed. So I know that doctors don't like this. They're waiting 8 months. But for a doctor, if you look at a Schedule B visit to the doctor, they'll have to wait 8 months for a 60-cent increase in that visit to the doctor. So it's not a large amount on each visit, and it's time limited.
But it raises quite an amount of money overall.
Well, that's because we spend a lot on Medicare. A lot of people visit the doctor, so a small amount on each visit. We've actually got 11,000 more doctors in Australia now than when we came to government as well. We've made it easier for people to see a doctor. We've got record high bulk billing rates. So I know that nobody likes to wait 8 months for a pay increase, but it is eight months and that's it.
It's 20 to 8 on Breakfast. Our guest this morning in the Parliament House studios is the Federal Health Minister, Tanya Plibersek. No one likes to lose a safety net either, and some of the cutbacks do affect the safety nets there for people who are paying a fair bit a year for their medical expenses. The extended Medicare Safety Net is available for people on lower incomes, and you're increasing that threshold from $1,291 to $2,000 a year, aren't you?
Okay, so there's two thresholds
There's
for
two
the
different
extended
things.
Medicare safety nets. There's two safety nets, but within the extended Medicare safety net, there's two thresholds. So we're raising the upper threshold to $2,000 from around $1,200. That will not affect anyone who receives family tax benefit Part A, so no one who's on $100,000 with one kid, $112,000 with two kids. It won't affect anyone who's got a seniors card. It won't affect anyone who's got a concession healthcare card. So it will not affect low-income earners or middle-income earners. 85% of pensioners pay no tax. They certainly, if they've got a seniors healthcare card, they won't be affected.
Their safety net stays?
Their safety net stays. So this is for people on higher incomes. They will see an effect, but the average effect for those people who'll now miss out is about $72 a year in 2015. So $72 for the whole year in 2015 is the average.
Much more money saved by the scrapping of the net medical expenses tax offset, something called NAMITO. $1 billion you're saving with that. It's claimed by more than 800,000 families at the moment.
Yeah, and it's claimed predominantly by high-income earners. So if you're on less than $60,000 a year, about 4% of people claim it. If you're on more than $500,000 a year, 10% of people claim it. It's wildly badly targeted. If you're a single mum looking after a disabled kid, you won't qualify for this because you're not paying any tax. It was introduced in 1936 when we had no Medicare. It was introduced in 1936 when we had no disability care. A lot of the things that are claimed under this will be covered by disability care. That's why it's being phased down while we phase up or ramp up disability care. It's the same with aged care. We're making massive new investments in aged care. So as those programs take effect, the requirement to have NAMITO will diminish.
And there is extra money, as you say, for cancer care, $226 million. What's that going to deliver? What's that going to do?
I'm really very proud of this. There's a range of different cancers that are covered here. We're extending the range of age range of women invited to undergo a mammogram, so up to from 70 to 74 years. We expect that'll pick up an extra 600 cancers a year. Very important. We've also invested more in prostate cancer, 3 prostate cancer research centres getting extra money to do that very important work. We've got extra breast care nurses, up to 57 now with the McGrath Foundation, caring for women who've got breast cancer. Extra money for lung cancer, the biggest cancer killer, 10,000 Australians diagnosed with lung cancer every year. Expanding the number of people invited for bowel cancer screening, and extra investment for young people with cancer as well through Canteen.
Minister, I know you're not the Minister for Mental Health, but there was a very disturbing report on 7:30 the other night following a Victoria Mental Illness Awareness Council report which found that nearly half the women in Victoria's psychiatric hospitals have been sexually assaulted while in hospital, which is a shocking figure. It reported men freely wandering into women's rooms, the wards not being monitored. It's been a problem for years, and the finding from the report was if this was happening in a mainstream hospital, it would be solved immediately. Is this something you will tackle? You will try and do something about?
Well, as you say, Fran, I'm not the Minister for Mental Health, Mark Butler is, but I was appalled when I saw this program on Monday night, and I asked for a briefing immediately from my department. We, as the Commonwealth, have been working with the states and territories. They run the hospitals day to day, but we have...
The model clearly is broken.
Oh, absolutely. And we've been working with them since February on a standards improvement program for their mental health hospitals. There'll be national standards and national accreditation for hospitals. But like you, I it's completely unacceptable. No woman should ever feel unsafe anywhere, and to be in a hospital undergoing treatment and feel that sort of unsafety or experience, it's completely unacceptable.
And just finally and briefly, Minister, one of your colleagues, Michelle Rowland, has a sick infant. She's been denied a pair, apparently, to go home. So she has to stay in the Parliament tonight for Tony Abbott's budget and reply speech. Is that still the case? Has anything changed on that front? Do you know?
Well, not as far as I know. I cannot believe this. This is really, to keep Michelle from her sick child, to sit in the chamber, to be an audience to a speech that even the Liberals are saying won't contain any new announcements, won't have any plans for the future, won't say what they're going to do, what they're going to spend, what they're going to save. Truly.
Should you just ignore it and go home?
Well, the Parliament doesn't run that way, unfortunately. We are bound to be here. When we are required, we are bound to be here. I didn't know I was going to get leave to have my third child until virtually minutes before it happened. It is, Tony Abbott's out there saying his paid parental leave scheme's better because he understands modern families. I think this is the best example ever that they don't care about modern families. She should be home with her child.
Tanya Plibersek, thank you very much for joining us on Breakfast.
Thank you.
Tanya Plibersek is the Federal Health Minister.
RN